join a concierge practice in the East Coast. And part of the thing that you pay X thousands of dollars a year to be part of the practice. And part of the thing is that they're going to expend, anyone who joins this concierge practice gets half-hour appointments instead of 15-minute appointments. So in that half an hour, which it takes me about that amount of time to write your name down and understand what your real complaints really are, that's going to be it. So you're going to get that type of level of care on a concierge level, but it's not going to be that effective. So these myths, the mythology that I talked about before, is still pervasive. So the concept of inflammation, as many of you know, as being a central feature of our pathology today, our explosion in pathology today, whether it's our cardiac status or digestive systems or metabolic systems, is truly important and truly key. So this was a reasonable cartoon, I thought. I have some bad news. While your cholesterol remains normal, the research findings have changed. So you can have your lipids normal and still get smitten, because that's not the story. The story is a fusion between lipids, inflammation, and psycho-emotional forces. We cannot explain why the mortality rate following cardiac surgery is 5-fold increased in patients in the first year in patients who are depressed. We cannot explain that in any way, other than you want to go down the route of adrenal stress and pro-inflammatory stresses, of course, and that leads to more prothrombotic states and so on. But these are important things. So the concept of our immunomodulation, I'd say the biggest driving force of modulating your immune system will be NRF2 agonists, will be oxidative medicine, will be high doses of vitamin C on occasion when you can get the intravenous infusions, will be vitamins A, D, E, K2 in combination in some formulation that your body can accept. Sometimes when it's wrapped in cellulose, you will feel sick, and you weren't sick before because you're now sensitized to cellulose, like many people in the population are, and that's why they're getting sicker with every supplement they're taking, because they can't tolerate the sensitivity to that particular protein. But the biggest driver is lifestyle changes. So there are experts in the audience that I'm looking at right now in terms of metabolic systems and nutritional systems. I mean, these are the things that will modulate your immune system more than any single other, any other single strategy. And that's why it doesn't sell big. And then you say, well, I want to know what nutrition I want. What do you recommend for me? And we have people who are very strict vegans and vegetarians who are very, very healthy and wonderfully adapted to it and are doing fabulously well. And others that are, having gone through that type of a detox system, have gone much, much worse because they're not suited for that particular type. I know, does anyone here have irregular heartbeats? So this is one of the major gaps in cardiology, because this is something that is very difficult to tease out. And the reason it's difficult to tease out, and the reason that it's done poorly on the medicine side, is because it's a system disorder. And the last manifestation of which is your irregular heartbeat. But the steps involved are easy to understand, but complicated and not sort of obvious. So here's what it looks like. Instead of having a sinus rhythm, you're going into a chaotic rhythm. Chaos, in certain traditions on the European side, are very important. The term chaos is very important because cancer is chaos, metabolic chaos and elimination pathway chaos. But on the cardiac side, I'm not saying cardiac disease is cancer, but I'm saying that it is the chaotic version of that same type of system pathology. And so it's one of these disorders that you can get from any variety of different indications. I have this CEO that comes in with a family history of atrial fibrillation. He had these atrial premature beats back in college. And then he developed paroxysmal atrial fibrillation. That means he gets atrial fibrillation on occasion when he starts this new company. And then he's treated with aspirin. And then the company has a takeover attempt, and he has a stroke. But all these chads and so on, I didn't have time. I don't think we want to go over these scores. These predictive scores were insensitive to his increased risk. I said, well, why me? You know, why this happened? How is it possible? I'm taking an aspirin. It's like the guy who used to ask me, how come I need cardiac surgery, doc, when I was in Hopkins? And he says, I'm just stunned that I need cardiac surgery. This was back in the late 80s. He goes, I eat a banana every day. And that's my commitment to my health. I mean, my commitment is so strong. How is it possible that I need cardiac surgery? I mean, I'm taking an aspirin a day. I mean, this should have taken care of this nonsense, nuisance symptom. But it took him down with a stroke. But he had family history. He had the genetic part. He had the first onset of symptoms even when he was a teenager. So long-standing stress response. When you asked him when you got it, he was doing final examination. But ultimately, when he became an adult, the stress component wasn't paroxysmal, only his atrial fibrillation was. He had inflammatory markers. He had sort of mild, moderate obesity after being a lifelong athlete. His diet was pro-inflammatory, and he needed a system-based approach. So basically what he needed was a look in a system on the stress axis side, on the inflammatory side, on the cardiac side in terms of ischemia and microcirculation, as well as metabolism and the global circulation. And without that, atrial fibrillation will increase, and is now triple in prevalence as compared to when I trained in cardiology. So three times more people now with atrial fibrillation than before, and that's because it's a system-based disorder, and our systems are becoming more complex. So how does someone like this need to be treated? They need to be treated with some understanding of their archetype. Some get off your ass and stop worrying about your company, and start worrying about yourself because you won't be able to enjoy it. Some concept of tempering your mind at night in particular so you can sleep properly, and have some kind of individualized nutritional program, and then have a naturopathic approach, preferably with some archetypal thing. And one of the things I want to, if I have time to talk, otherwise I'll talk in the question Q&A period, of a system of medicine that we follow in the clinic based on the Korean Sasang medicine. Sasang medicine is a very individualized form of medicine and can determine your constitutional archetype that you're born with that would be suited to eat certain foods versus others. Certain people in the audience live like that. I do. And it's very, very accurate, and it can be very effective. And it's most effective when you're not very ill, because Eastern medicine doesn't understand the need for our level of gut repair that we have now. They don't understand food sensitivities as to the extent that we currently have it. So if you are relatively well and you want to prevent things, understand which of the many different diets will be best suited for you. Certain people get sick using paleo, some people won't do well without a paleo diet, and we have to understand the individualization. So when you look at atrial fibrillation under the microscope, which I understand, you find certain things. This is, of course, an autopsy. This is not from a live person. But you understand this blue is the scarring in that part of the atrium, that part of the heart that is responsible to generate the beat, the regular beat. So this is a degenerative condition that's affecting that part of the heart. And then there's an inflammatory component. You see with all these little dots, these are little lymphocytes. So what are they doing there? What are they doing there? There's no particular viral illness here. It's just there. Well, it's there, but there's an inflammatory component as well. And then there's a vascular component. These blood vessels here have scarring around it. This person had no hypertension, so it's unexplained. So something is going on in terms of this is where the lymphatics in the heart are. So something going on in the lymphatic circuit that's not properly eliminating things within the heart. Just like we're not eliminating properly in the brain. So our explosion in heart disease and brain disorders are because our lymphatics and our microcirculation aren't adapting well to the toxicity. It's certainly acidic qualities. Our systems are gunked up, and we don't have a mechanism, easy mechanism to address that. One of my favorite discussions is just, I think we're targeting 9 o'clock?
No.
We want to give you, we want to stop with
Oh, okay.
Q&A.
Okay. Okay. So, for the people that say, listen, I just want you to just tell me what I need to do, and stop giving me these complex diagrams. I say, well, think about yourself as a Porsche. Most guys love that. And think about yourself that you need to be regularly monitored. And think about the concept that your wiring needs maintenance. These are simplistic ideas, but without this thinking strategically and understanding what your basket of things that you have on your bathroom window are trying to address, and trying not to address them all at once is really going to be pivotal to come up with an individual plan for yourself. And I have a lot more slides, but I do want to come to, it's the concept of the immune rigidity is I just wanted you to be aware of this concept, because I, as an immunologist, am totally blown away by the increased prevalence of all these disorders. And to a large extent, a lot of my practice deals with these disorders, and to a large extent, people with these disorders have long laundry lists of symptoms, have the same type of things that I'm worried about 20 years later for them. And if we don't address them, we're going to have to deal with other consequences. This is one of the quotes that I like to use too, that was addressed in an earlier conversation during our opening statements. I think that it's important. I will tell one story, and the concept of, I do want everyone to be aware of this. In the United States, there's no more primitive form of medicine than oncology. Fundamentally primitive. Fundamentally unchanged from 1970, when Professor Nixon declared the war on cancer. It's fundamentally not different. And you have to understand that there are tools out there that I'm aware of, and clearly some of you are as well in the audience, that when you have a tumor and you address it in a specific way, you have to have a strategy of following yourself. Because our current system deals only with the observation of whether you have the mass or you don't have the mass. It talks nothing about your risk of future risk. It talks nothing about your current load of your cells that aren't embedded in the mass but are circulating in your body. So we knew about circulating tumor stem cells 30, 40 years ago. And we had the means to measure them 30, 40 years ago, because all these stem cells have certain, these microbeads or fluorescent beads that are targeting the cell surface. So we knew how to immunophenotype these. We knew the histochemistry was available 40 years ago. But there isn't a single laboratory in the United States that measures these circulating tumor cells. So we have to ship our samples to Greece, to the best laboratory, I feel, in the world, although there are a few others in Europe, that will measure these tumor cells in anyone with a tumor or in someone like a 60-ish-year-old male who wants to know whether he has circulating tumor cells on the prostate side. Because I certainly don't want anyone to biopsy my prostate, because I don't want the risk of it spreading. And so these type of technologies do not exist here, but they do exist elsewhere, and I think we have to begin using them. And I had 2 examples of how it was used, but it has to be used. And the other thing I wanted to close with, because I won't be able to show the stem cell on a video that I wanted to show, but there's a growing interest in using different forms of technology that you could just have as part of your day-to-day life. And part of this is these molecular-based oxygenated waters. And it's not clear to me it has anything to do with the oxygen. It may be doing with the way the water is prepared. These are electrolytic forms of oxygen. These are beverages, these are waters that are exposed to different electrical systems. There's one nanotechnology here that produces nanobubbles, and I think the nanobubbles have electrical charges and enter into the Krebs cycle. Enter and become, your oxygen utilization becomes more efficient. So we have oxidative medicine, but we'll also have different things. And then Bert's technologies in the future that he's more adept at than I am in terms of the electrical system. System-wide approaches have to be layered on to individual vitamin supplements. I mean, you can go down to K2, A, D, E, Bs. Some of you are sensitive to them, some of you are not, but you need a system-wide approach. So you need something that will increase your oxygen utilization. You need certain things that work on the system level. This was the genius of Linus Pauling and orthomolecular folks back in the olden days that I know very little about, and many of you know a lot more about. But the genius was look at the whole system as a whole. These are all going to be, this list next year will be double, and in 5 years we'll take up the entire page. There will be more directed system-wide approaches. It's not going to come from pharma. It's going to come from the consumer-driven markets. The data are going to be lousy, but you're going to have to try it. As long as it's safe, you'll figure out which ones work best for you. And I don't think there's any other approach, because one thing that we don't do well in the alternative world is we don't collect data well. And we don't have a way, a mechanism. We don't have the machinery to do it. We don't have the funding to do it. And so you have to take individual incentive and do it on your own. So I'll close with that. Thank you. Yes, please.
First question.
Hold on.
Okay.
Test.
What about epigenetics? In 23andMe, everybody thinks that the gene profile is set in stone, and I'm not convinced whatsoever. And therefore, basing protocols and diagnoses, et cetera, on how your genes come out, I don't know is how valid.
No, but I completely agree. Everything on the right side of that core diagram was all epigenetics. So all of that was the terrain.
Yeah, it's just I find that a lot of
That is the term epigenetics. That is your genetic interaction, your interaction with your genes with your environment. Everyone's writing books about, the ill population with methylation pathways being disturbed. But in routine life, when we're not critically ill, this is the reality. The reality is that our genetics roughly explain, in mathematical models, roughly 10 to 15% of our expression of disease. The rest of it, 85+%, is determined by our interaction with the environment. So epigenetics dominates, and I think that's fairly clear to me, and that's what the data suggests, around 80 to 90%.
That's not
You had a thing on one of your slides, like population data is not usually suited to the individual.
Yes.
But there's a book, The Blue Zones, where several neurologists went around the world to find people in what countries live to be 100 years old. Now, if you copy what they do, their diet, their thinking, their exercise, I think you have a better chance of being healthy and living to 100. And none of them saw doctors.
Yes.
None of them took any medicine. And there's 4 countries where they all live to be 100.
Yes, but you're right. I'm in complete agreement. You will do a lot. You'll do better if you follow that model, eating natural. In those type of systems. But what I'm just saying is, there is no such thing as the average patient. The average patient is a statistical term. The mean, who's the median patient? Who's that patient in the center? There is no such, this is a fictional thing. There is no average patient. So this, you should understand that the average patient when you use the average, when you use the pharmaceutical model, remember, an outstanding result is 30% efficacy. Because you need about 30% to beat placebo. Placebo roughly works 25% of the time. So you need 30% to beat it. But when you do beat it, you're not beating it for the other 70%, because there is no such thing as an average patient.
Last question.
I was when I came here, when I saw your leaflet, I was hoping to hear about how you practice something about cell therapy. So would you be willing to come back and tell us how you do it?
Yeah, it's just impossible to do it in a short period of time. Of course, I'd be thrilled to do that.
That's probably a lecture all in itself, so. All right, thank you, Dr.